You have to do an introductory.
Yes, my name is Ola, and we're going to have an in-service about infection control. This is a clinic where we do hands-on patient care, being a dialysis clinic. We touch our patients, we touch their blood. So first I want to explain what infection control is. Infection control is reducing the transfer of infections from one patient to the other, either from patient to patient or healthcare worker to patient or between healthcare workers. So it is transferred either through touch, food, or airborne. The purpose of this teaching is to help us reduce transfer of infection between ourselves and to our patients. The goal is to reduce infection, so and reduce hospital costs, because when there is infection, we have to send them to the hospital, and that is, insurance bills and everything. So, but how do we reduce infection in a healthcare facilities? Infection is mostly transferred through food, through touch, mostly through touch. As we touch one another, touch our patients, and we can reduce it by wearing our gloves, wearing our protective equipment, and making sure that we reduce airborne contact with our patients, either maybe when they're coughing or sneezing and stuff like that. And that would go a long way in reducing infection. But how do we know that our patients have infection? How do we know? How can we, know when a patient has an infection?
So
Through vital signs.
Vital signs. Through vital signs, fever. Once there's an elevated temperature, we know there's something going on with our patients, and we know that it's an infection, especially in this facility where we have catheters, patient catheters, and we're changing catheters with, touching them with leads directly into their blood system. So once we do our vital signs correctly and we see a change in our patient's vital signs, we begin to suspect infection. And once we do that, we're able to really take care of them quickly, so that will reduce their hospital stay and insurance costs. So once we, even amongst us healthcare workers, between ourselves, before we touch each other, touch our patients, hand washing, proper hand, not just putting hand under water, but proper hand washing with soap and water. And if we cannot, get to soap and water, hand sanitizers, just to make sure that we're transferring infections as minimally as possible. So that is that about infection control, and we have said it is vital to get the proper vital signs of our patients, so that will help us to prevent transfer of infections. Any questions for me?
No questions.
No question. I thank you for listening to me and helping us reduce infection in our patients as much as possible. Thank you.